Individuals from areas of deprivation can expect to have their life expectancy cut short by close to a decade. But life is not just about how long we live. Those living in the most deprived areas spend nearly a third of their lives in poor health. For many in low-income areas, life can at times be chaotic, complex, with inherent instability and injustice. For the GPs and primary care teams working in these areas, the challenges remain, often working with stretched teams and funding that does not reflect the workload. It is into this reality that Focused Care walks. Focused Care emerged from grassroots general practice in Oldham and remains embedded in primary care. It is designed to help tackle issues of poverty, engagement and health in a very practical way. We deliver proportionately to need, basing our allocation on practice list size, deprivation rating and need. Focused Care is not restricted in the way it supports patients in terms of time or intervention. Our referral criteria is based on failure to thrive in paediatrics and also which patients are clinicians worried about, concerned about, or where something doesn't quite add up. The discharge criteria is gaining stability. Focused Care practitioners work with the whole household to unpick the interlinking strands. Often clinical care is needed to resolve or diagnose issues alongside support with housing, money, relationship issues, access to basic services such as heating, food and water. Practical help is given, such as finding furniture, cots, buggies, or taking someone to their hospital appointment to ensure they get fully assessed and understand the next bits of a treatment journey, whether that is physical health, mental health, or addiction concerns. Practitioners are able to be both proactive and reactive to the changing needs of patients. Focused Care practitioners are specialists. With a minimum 8 years' experience in a health or social care setting, this experience allows them to hold and manage higher levels of risk and work at a depth and complexity level not seen elsewhere. This ensures Focused Care remains complementary to existing services. The Focused Care model takes a truly holistic approach, working in collaboration with the primary care team and local services. As part of the primary care team, Focused Care sits in this sweet spot of overlap of clinical, mental health and social support. Independently evaluated several times, Focused Care has shown a reduction of A&E attendances, a reduction in unnecessary use of appointments, and increase in job satisfaction and sustainability of GP teams. More than this though, Focused Care has story after story of families being rehoused, victims leaving domestic abuse, patients engaging with their mental health and mental health therapies, stopping drinking and taking drugs, of patients going for surgery they'd long put off, of children catching up at school, of vaccination and smear rates improving. As one GP says, Focused Care allows me to be the GP I always thought I would be, helping those most in need. Focused Care, making the invisible visible.